Now to the coronavirus crisis. In the 2 years since the pandemic began, COVID-19 has infected more than 310 million people around the world. And the World Health Organization says the Omicron variant will infect more than half the population in Europe in the next 2 months. Acting FDA Commissioner Janet Woodcock and President Biden's top COVID advisor, Dr. Anthony Fauci, are also warning Americans it is inevitable that we will all wind up getting exposed to COVID.
I think it's hard to process what's actually happening right now, which is most people are going to get COVID.
What Dr. Woodcock was referring to when she said most of us will ultimately get Omicron is not that most of us were ultimately going to get sick with Omicron. Remember, she was talking about in the data that we all showed about the extraordinary effect and dichotomy between people who get Omicron, who get vaccinated and boosted, how well they are protected against hospitalization and death.
The Biden administration announced it will send 10 million rapid and PCR tests to schools each month. This is part of an initiative to keep schools open and safe. CBS News' Skyler Henry has more from Washington.
The White House announced it's shipping 10 million free rapid COVID tests to schools each month.
You're going to see distribution of tests as early as next week to make sure that our schools can stay open.
The announcement is part of the government's test to stay recommendations for schools to reduce quarantines for those who had close contact with a confirmed COVID-19 case.
These 10 million additional tests available each month will allow schools to double the volume of testing they were performing in November.
Nearly 5,400 schools reported disruptions to in-class learning last week. Midweek this week, that number is already over 3,000. The Biden administration is also finalizing plans to ship 500 million free rapid COVID tests directly to Americans' homes. This comes as Omicron is sweeping the country, and Dr. Anthony Fauci saying the variant will infect just about everybody, regardless of vaccination status.
I want to underscore the importance that the up-to-date COVID-19 vaccination with boosters prevents severe disease and keeps you out of the hospital.
The U.S. set a new record with more than 1.4 million new COVID cases Monday. Skyler Henry, CBS News, Capitol Hill.
We're now joined by Dr. Susannah Hills, pediatric airway surgeon and vice chair of ENT at Columbia University Medical Center. Thanks for joining us, doctor. You know, pediatric hospitalizations are at their highest point of this pandemic. The CDC data shows that from early January, there are 5.3 COVID-19 hospitalizations per 100,000 children ages 0 to 4. Towards the beginning of this pandemic, many experts said that kids were less likely to get seriously ill from COVID. Has the Omicron variant changed that thought process?
I think, Jerika, it has. We really have to shift our thinking from viewing this as a disease that doesn't really affect children to one that clearly is affecting kids. We're seeing, here in New York City, we're seeing them across our hospital system. Of course, it's important to remember that we're primarily seeing them with mild symptoms or even incidental findings. When I'm testing patients before doing surgery, we get a positive test. But absolutely, we're seeing them admitted to the hospital. We're seeing patients when we're on call. When I'm in the ICU or in the inpatient wards, I'm seeing patients that have COVID-19. So it's really important to think of this virus now as something that is affecting our children. It's occasionally affecting children severely. And because of the numbers of kids that are being infected, it's so important that parents really strongly consider getting their kids vaccinated if they haven't yet.
And when you talk about being severely impacted, what are we still learning about exactly how these children are affected? Is it through the breathing? Is that the reason that's ending them up in the hospitals?
Most commonly, the interesting thing about this particular variant or strain is that it seems to be affecting the upper respiratory tract first before impacting the lungs. There are certainly kids who are in the hospital with pulmonary issues requiring help with their breathing because their lungs are affected. But oftentimes the first signs we'll see, particularly now with this variant, are upper respiratory tract infections. For the older kids, that's less of a big deal, but we're seeing an increase in cases in the kids under 5 who are in the hospital, and some of them are presenting with significant illness, because in a small baby with a narrow airway, when you get an upper respiratory tract infection and it gets swelling in your airway, that airway becomes narrowed. And when you already have an airway that's particularly small, kids can develop real difficulty breathing, and it looks kind of like croup.
Yeah, it's so sad to see some of those images we have seen of babies struggling to breathe. Schools are reopening today in Chicago, where the teachers union, as you know, fought for more COVID protections in classrooms. What are your thoughts on in-person learning, especially when considering the FDA acting commissioner commenting, saying that in the end, you know, we are all going to get COVID?
I agree that this virus is affecting so many people that likely everybody will be infected or be vaccinated, or a combination of both. I mean, when we're dealing with 700,000 cases a day, it's a tremendous, tremendous number. But the problem is, when you view it just through that lens, that you're not accounting for the fact that everybody is getting infected at the same time, right? We're having these huge numbers of patients in our hospital, huge numbers of children infected in our school systems. And so it's the volume at this moment. If you spread that out over time, it's much more manageable, and the healthcare system and school systems aren't so severely impacted. I personally feel like the effect of being out of school over the last year and a half for children has been severe. Of course, I think most parents feel that way too. We see kids with developmental delays in our clinics all the time who aren't getting the services that they need when they're out of school. And it's exacerbating learning difficulties. It's exacerbating setbacks for kids who are already struggling for a variety of reasons. So it's so important to get kids back to school. I think with this variant that is more mild, I think it's very reasonable for kids to be in school, but the protective measures of masking and access to masks through schools and testing are really critical to being able to keep schools open safely. So we've got to make sure we allocate those resources fairly, distribute them equitably, and help schools stay open safely.
That's right. Well, you know, if we are all destined to get COVID, do you think that Omicron is the turning point for us possibly hearing the word endemic, the endemic stage of this virus?
Yeah, that's such an important question for how we look to the future. I think at some point, and most public health experts are thinking this too, that this virus is likely to become endemic. I don't think we're ever going to say we're beyond having to deal with the coronavirus or COVID-19 illness. When it becomes endemic, meaning sort of a regular part of our daily existence that's manageable, is unclear. You know, we have flu as part of our yearly life, and it has cycles where we have a surge in the wintertime. So once we develop patterns with the coronavirus that are a little more predictable, it waxes and wanes, and the strains become manageable, then we can view it as endemic. I think that's probably not going to happen this year. It will probably take time to develop a regular pattern that we can predict and manage a little bit more routinely.
And I think the key word in endemic, people hear and you think, end? Are we getting close to the end? But like you said, it's here to stay, and we just have to live with it. Dr. Susannah Hills, thank you so much for your time.
Thank you so much.